are pleased to have you join us on Newsroom series today. I'm Olumide Macaulay. Thank you for being with us. Our focus is the southwest region of the country, but first we begin in the north central with our top stories. Governor Hyacinth Alia of Benue State has directed joint security operations to move into Apa and Gwe West local government to halt the killings, as he confirmed that 12 persons were killed in Apa, while 11 persons were killed in Gwe West local government area, bringing the total to 23. Addressing journalists after an Emergency Security Council meeting at the Government House, the governor condemns the attacks in the two local government areas. He says more information will be made available soon as the team hits the ground, with the likelihood of the casualty figures changing, as security operatives have been directed to sweep the affected communities and restore peace, law and order.
I'm just coming out from a meeting with the security heads in the state, the military, the police, the civil defense, and the DSS, and all the security advisors. So they've been directed to move immediately to the two local governments. So that is where they are headed now. The figures of casualties we're hearing in Apa. We had 7 injured people, and the injuries, some injuries were life-threatening, and therefrom 3 people were lost at the hospital. Right at the spot in Ampali Idiku area, 8 lives were lost immediately. We also got on-the-ground assessment and reports from the military that 1 other life was lost. So now, officially, what they have reported to us is 12 bodies, 12 lives lost, and 12 bodies were recovered. Some families had buried. Some lost life from their families immediately. But we're hoping that once they get again on ground, coupled with the reports we have received from families and from government officials there, then we'll be able to update you as well.
The Nigerian Navy is expanding its operational capacity to enhance national security. The Chief of Naval Staff explains that the force is set to establish a Special Operations Command and deploy Marine units for missions, particularly to tackle rising insecurity in Benue State and other parts of the country. Speaking as a guest on our program Sunrise Daily, the Naval Chief explained that the introduction of the Special Operations Command is part of a broader strategy to adapt to Nigeria's changing security landscape.
We have what we call our total spectrum maritime strategy, which identifies our operations to be conducted in 5 spectrums. One of those spectrums is land operation. And this is because the Navy is expected to provide what we call civil aid to military aid to civil authority and aid to civil power. That's why we are deployed in almost 30 states of the Federation in support of the Army and the police in fighting insecurity. That's why we are deployed in Maiduguri, Lake Chad, the Northwest, Northeast, South, everywhere in that particular role of provision of aid to civil authority. And we identified that because of our very few numbers, that we are having limitations with respect to being able to provide the much needed force. We also have limitations with respect to providing personnel who are adequately trained to fight on land, being that our orientation is maritime based. So the Special Operations Command and the Marines that we're establishing, they're essentially to be able to train people who can fight on land in line with our total spectrum maritime strategy. We're already doing it, but we want to do it better. And why have we chosen Makurdi. Of course, you know the River Benue is a vast expanse of landmass and the insecurity that is taking place in those areas. And also you notice that the elements of that command will not all be in Makurdi. For instance, the Navy base in Lake Chad will be a unit of that command. The Navy base in Shagunu will also be a unit of that command. So many of the units that are fighting on land, for instance, also our Special Boat Service, all those units will be part of the command. So the command is essentially to provide a coordinating framework for all our special forces operations that are supposed to contribute in provision of internal security and civil aid to military aid to civil power.
Our focus on the program today is the southwest region of the country, and we begin in Oyo State, where the government has sealed off the site of a collapsed building under construction belonging to a popular restaurant located at the Dugbe area of Ibadan, the Oyo State capital. The Commissioner for Lands, Housing and Urban Development, Mr. Williams Akinfumilayo, who spoke with newsmen after an on-the-spot assessment of the collapsed building, says the action is to prevent casualties, ensure safety of lives and property, and allow the government to report on the cause of the incident. The commissioner notes that some of the materials used for the construction of the building were substandard. He added that the integrity test will be carried out on the collapsed structure and other branches of the restaurant in the state to avoid another disaster.
From what we've seen here, substandard materials are being used. From what I have seen, which has equally been corroborated by professionals from Ministry of Works. Together in my team here now is a Director of Public Building. She has equally looked at it and confirmed materials are substandard. But however, they are still going to go for integrity tests, whereby absolute professionalism will be exhibited, and the result thereafter will direct the action the state will take. There is an approval for the redesign. The building has been existing before. There's a kind of renovation coming up. And from the information I got, there is an eatery outlet trying to have an outlet over here. They are the people trying to do the renovation. But fine, there was an approval. But like Radley said, professionals are equally monitoring them. But we never expected what actually happened. We never expected it at all.
The Lagos State government has declared zero tolerance for any problems caused by the operations of cart pushers. State Commissioner for the Environment and Water Resources, Mr. Tokunbo Wahab, made the comment during an inspection and enforcement exercise in Mushin and Alaba Road markets. He emphasized that governments will step up efforts to clamp down on the activities of cart pushers in a bid to maintain environmental sanity. He also says residents should imbibe good sanitation practices for their own health benefits.
Environmental concerns in Lagos has continued to put the State Ministry of Environmental and Water Resources on its toes to achieve a livable and hygienic atmosphere for all citizens. The State Commissioner for Environment and Water Resources, Mr. Tokunbo Wahab, and his team visited Yaraba in Mushin area of Lagos to eliminate environmental infractions, one that is very much visible within this axis. From Mushin, the team proceeds to Alabarago Market, where illegal trading, indiscriminate dumping of refuse, shanties have completely occupied the road, defacing the entire environment, and the Commission is not pleased with the situation of things.
If anybody and any tech, normally is always to start
And orders immediate cleanup.
The law on environmental management and protection in the state prohibits cart pushing. And the past few weeks or months, there's been a major enforcement against cart pushing statewide to enforce the law. So we now had intelligence that this whole cart pushing thing, there is a syndicate kind of behind it around the Diaraba. And we all had to go there, and you saw it yourself. And from there we came to Alabarago. Alabarago, we've been here before, sometime last year. And we had to seal the market for them to do the right thing. Unfortunately, we may have to tread that path, but tomorrow evening will determine if we should or we shouldn't.
At Orile Igomu, the situation is the same. The environment is unkempt. The team discovered that the Igomu water channel has been blocked by refuse, and the government says it will be cleared to ensure free flow of stormwater.
The other side of this place, there is a system there that gets to flood, and it's been awarded. However, that will not be holistically done without looking at this side of the road, which is to system 5. So, just need to see and appraise it, so Aloma can come in this week and start moving those jets so that the water can move to system 5. We can't say because you want to do Salah, you now become a law unto yourself. No. You work within the ambit of the law of the state. Clean up the environment. Take ownership of it. You can't block our roads with chalks. So, as when there was an emergency on this part some minutes ago, the person will be dead. And they have to know all these things. And that's why I was telling the chairman, no, don't talk about Salah. Take ownership.
The Lagos State government says the monthly environmental sanitation exercise will be restored soon, and government appeals to the people to keep the environment clean during and after the Salah celebrations in order to prevent any disease outbreak during the rainy season.
Over 11 million Nigerians are now covered under the state health insurance scheme. This was announced at the Forum of Chief Executive Officers of the state social health insurance agencies, where the Managing Director of the Anambra State Health Agency, Dr. Simon Onyemechi, was re-elected as chairman for another 2-year term. In his first address, he reaffirmed the forum's commitment to accelerating health insurance penetration across Nigeria. Also speaking at the event is the Publicity Secretary of the Forum and Permanent Secretary of Lagos State Health Management Agency, Dr. Emanuela Zamba, emphasizing the inclusivity of social health insurance, particularly for the informal sector and vulnerable populations, announcing that Lagos State has recorded an additional 6% in health insurance coverage within 7 years.
As a country, we have chosen for ourselves a pathway to attainment of universal health coverage. And the two strategic pathways that we have identified as a country are the part of social health insurance that will leave no one behind, and an effective primary health care delivery system. With those twin strategies, Nigeria hopes to attain universal health coverage in line with the Sustainable Development Goals 3 Target 8. Now, for every state of Nigeria to get to the point where we all have attained UHC, there was a need for a robust engagement, a peer learning mechanism across our states. Because if there are certain states that are doing very well, while others are not doing so well, at the end of 2030, which is a set year for determining what countries of the world have attained UHC, Nigeria will not have been included in that number. But to have every state rank in such a way that the aggregate of what happens across our subnationals will give us a national data that says, yes, here we are with universal health coverage. There are lots of social equity funds in some of these social programs, the conditional cash transfers and the household cash transfers that are given to millions of persons across Nigeria. We are pushing and hoping that Nigeria soon will get to a point where there is no point giving anybody those conditional cash transfers without paying their health insurance premium.
Social health insurance is actually for the masses. It is the one that concentrates on the people that are largely uncovered, who are in the informal sector, or those that are not that economically empowered, including those that are vulnerable. And these are the large expanded population that need to come under the health insurance coverage. Social health insurance is inclusive, and of course, what we are supposed to be doing as each and every one of us have an agency in our state is to ensure that we concentrate on those people that are uncovered and we bring them into the pool. So our premiums are affordable. We have a robust benefit package, and it is something that we are able to show credibility and ensure that whether you are in the informal sector, whether you are an SME, you can come on board and you are assured of your health insurance. Of course, if you are vulnerable, most of us have equity fund. There is also the federal government fund, which is called the Basic Healthcare Provision Fund, that is sent to each state to be able to enroll the vulnerables that they have in those states. So in the last 7 years, as the chairman have pointed out, we have grown the health insurance coverage in Lagos State by an additional 6% simply by our existence. And the sky is the limit.
All hands must be on deck to ensure that the girl child receives adequate and timely support as she grows up, in order to prevent abuse, health risk, and other factors that could inhibit her development. The wife of the Oyo State governor, who is leading the campaign for the girl child development, made this call in Ibadan, the state capital, where she urges schoolgirls to maintain healthy menstrual practices. The event aims to normalize menstruation by 2030, emphasizing the need for a supportive environment for girls during their menstrual cycles.
Schoolgirls from across Oyo State gather at the House of Chiefs, Oyo State Government Secretariat, Ibadan, for an important meeting with the wife of the state governor, Mrs. Tamunominini Makinde, which focuses on their development and well-being.
So as I said, going to be very interactive. How many of us girls here are menstruating?
The theme, A Period-Friendly World, aligns with several sustainable development goals, including SDG 5, gender equality, SDG 6, clean water and sanitation, and SDG 4, quality education. Mrs. Makinde stresses the importance of equipping teachers with the knowledge and resources to ensure that girls can manage their monthly cycles with confidence and dignity.
Don't let people touch your bag about that period of hold your bag. So one is for clean things, one is for disposable things. Now, you can get small towels. You just get small bottle of water. Even if there is no water, you wet the towel, you wipe, you wet, you wipe, you have two. It's good to go. You don't need to have a school that have heavy flow of water. But you can manage what you have. As you're coming back from school, go to the primary healthcare center near your school. You can take permission from school, ask your teacher to give you somebody, go with you to the primary near your school. And tell them what is wrong with you, and they will help you. Don't be what? Don't be what? Don't be afraid. And don't be shy. It's your body. Don't cut corners.
In his remarks, the Commissioner for Education, Science and Technology, Segun Olaiwola, encourages participants to raise their voices against stigmatization and to support one another.
Let's support each other, for together we can achieve our feat. When menstruation is a normal part of life, this will mean girls miss school because of their periods. No one is teased or shamed for something natural. Period-friendly world means that every girl has access to pads and sanitary products needed for proper hygiene. Imagine a world where we can talk openly about our period, encourage each other to eat healthy, exercise regularly, prioritize our health. Picture a world where we help each other through tough times, tough period, and other health struggles.
Many students describe the meeting as impactful and empowering.
I learned that we should always take care of ourselves whenever we are on our menstrual period. And also, we should always learn to keep some special pads with us whenever we are going out, because our menstrual can come anytime.
I learned that we should always guide our friends when they are doing menstruating. We should not always go and put them at shame in when their other friends are gathered. We should guide them. We should always wash our pad when using it and don't expose it to where it's not good. we should wash it and bathe twice in a day when we are doing it.
The event underscores the critical importance of timely and accurate information on issues affecting the girl child, noting that a lack of information about menstruation often leads to misconceptions and discrimination. Bukola Uriowo, Channels Television News.
As part of its corporate social responsibility, the Oyo-Osun Command of the Nigeria Customs Service has provided free medical outreach to residents of Osogbo and another area in Osun State. The free medical mission, coordinated by the Medical Services Department of the Nigeria Customs Service, enables hundreds of vulnerable residents to access vital healthcare services. These services include diagnosis, treatment, including surgeries, and lifestyle advice to address various ailments.
Residents of Osun State, particularly those in the state capital, Osogbo and Modakeke, welcome officers and men of the Nigeria Customs Service for this crucial initiative. The Free Health Mission supports the government's ongoing efforts at all levels to promote a healthier population. The program specifically targets vulnerable individuals who need medical care but cannot afford it.
The purpose of this year's retreat, as approved by the Controller General of Customs, Adeni MFR, is to strengthen our ongoing initiative, corporate social responsibility initiative tagged Customs Care. And Customs Care includes mainly giving to the needy in terms of education, and most importantly, healthcare.
We're here with the full complement of a medical team. We have doctors, general doctors and specialist doctors. We have our laboratory people. We have our nurses, pharmacists, and other members of the healthcare team. And the intention is to carry out general medical consultations, specialist medical consultations, dental care, eye tests, free laboratory tests, and importantly, we'll be carrying out no less than 30 cataract surgeries.
Although the initiative has been running for several years, the command currently decides to extend its impact to Osun State.
We have established complete clinic networks in all 6 political zones, ensuring no officer is left without access to quality medical care. These facilities represent our unwavering commitment to the health and well-being of both our personnel and the immediate community, they said.
Speaking on behalf of the Osun State government, the Ministry of Health appreciates the timely intervention, noting that it extends lifelines to many who desperately need it.
I'm happy because the citizens of our state, Osun State, we only have the opportunity of benefiting from your health interventions. Your vision and mission on this align favorably with that of our own government, because it is the belief of this government and indeed the whole world that health is wealth.
Several beneficiaries commend the effort.
The service is very perfect. I want to say very perfect. I was here yesterday. I went through some tests and they asked me to come this morning. Unfortunately, I've gotten what I needed. So I think the service is very, very good.
The free medical services include general and specialist consultations, laboratory tests, dental and eye care. Notably, no fewer than 30 persons benefit from free cataract surgeries, among other medical procedures. Recommended medications are also distributed free of charge, while those diagnosed with critical health conditions are referred to appropriate health facilities for further care.
Finally, the federal government has promised the completion of the first part of the Ado-Ekiti-Akure Road by December. The Minister of Works, Mr. Dave Umahi, disclosed this during an inspection tour of the road project. It aims to improve road infrastructure and reduce travel time between the two cities.
Ado-Ekiti Akure Road, connecting the two major cities in Ondo and Ekiti states in southwest Nigeria, is undergoing a major reconstruction. The road had been in a deplorable state for many years, making it a dangerous spot for kidnappers to strike, a major cause for concern for commuters and people living in both states. The project, which is being closely monitored by the Federal Ministry of Works, aims to improve the road infrastructure and reduce travel time between the two cities. During the inspection, the Minister for Works, represented by the Permanent Secretary in the ministry, emphasizes the need for quality and assures residents that the first phase will be delivered this year.
Our target is that by December this year, we want to trust God to get Mr. President to commission the first lane so that somebody can drive through. You know, the benefit of a good road are so enormous. The travel time is reduced. 2, movement of commercial activities is heavily enhanced. 3, job creation. 4, above all, security. Because this place they used to kidnap before, but with the road they have completed now, nobody can capitalize on any trouble spot to kidnap anybody.
The contractor working on the job also promises quality.
Copper Construction Company has been working in Nigeria for more than 30 years. So during that time, with all that experience that the company has, we have gained a trusted reputation on both federal and state levels. So we are known for delivering high quality and fast job. So we can assure the people of Ekiti that we will deliver good quality and the fast job.
As the federal government promises to deliver a portion of this road by December 2025, transporters are also appealing for the commencement of the reconstruction of the Ado-Aramoko Road, which is also in a bad state.
And that's it on Newsroom Series today. Thank you for watching. I'm Olumide Mukol.